What are the financial considerations you should be aware of prior to starting adjuvant therapy for your melanoma? One of the first things you should discuss with your provider prior to embarking on any adjuvant therapy is, how do I pay for this medication? These new medications, either immunotherapy or the targeted therapies, can be very expensive and can be financially burdensome in different ways. While immunotherapy is generally given in an outpatient treatment facility and is an IV infusion, this generally falls under major medical. As far as insurance, however, many patients have copays for the infusion time, chair time, or any additional medications that you may need. One thing to do is to make sure that these have all been prior authorized with your insurance prior to your very first dose. It's best to get this in writing if your insurance will provide that for you. When considering on embarking on adjuvant BRAF/MEK inhibitor therapy, these are oral agents, and these generally fall under a different class of insurance, namely prescription drug coverage. You need to be very well aware of what your copay would be for these medications, and these also need to be prior authorized with your insurance prior to beginning. These therapies generally last for 1 year, and some patients may have an out-of-pocket max for their copay, so it may be more expensive up front, and then those copays diminish over time. Finally, one other consideration is, if your copays are very large, tapping into the resources that the drug companies have provided for this. Many of the drug companies, including Bristol Myers Squibb as well as Novartis, have patient assistance programs. And speaking with your providers about enrolling you in one of those programs, depending on which treatment you take, from the very beginning. They can also be very helpful with prior authorizations with the insurance, and can be helpful with those copay assistance, especially with the prescription drug coverage. For patients who have federally funded insurance, one needs to remember that oftentimes that will exclude you from a direct copay assistance program from the drug company. However, many of the drug companies have access to private foundations that can be utilized in these cases to help with copay assistance. One additional final consideration is, do you need to be away from work, and what your status is at work with regards to time off, both for treatment as well as treatment-related side effects. Many companies have programs for patients who have a chronic illness. You may need to consider filling out FMLA paperwork and or short-term disability, and these would all be things to check into prior to starting therapy.